Good morning, Maryland. I'm Christian Schaffer. Thanks so much for joining us on the Facebook Live page for another special interview with GBMC. I am joined by Dr. Elie Miller, who is a family physician at GBMC. Dr. Miller, thanks so much for joining us.
Thank you so much for having me on today, Chris.
Sure. It seems like a family physician is right on the front lines of healthcare. Talk about what it's like to be working in that field.
So indeed it is. It's really a ever-evolving field of medicine, much like a lot of healthcare today, which kind of continuously transitions its role, but specifically in family medicine, where on a day-to-day basis, we handle adult medicine, pediatric medicine, geriatrics as well, and really an array of questions. Often describe it to people as the first line for patients who have questions, other than Google, of course. This is where patients come, whether it's a question about vaccine, a question about recommended cancer treatment, a question about a sprained ankle. It often starts in our office, and that's where the conversation starts, though it often spreads from there.
You know, it's an interesting issue that you bring up. These days, people can just find the information on their own, or at least they can try to. And in some cases, the old internet might lead them down a path that may not be the right one to go. What do you tell people when they've come in or they bring information to you that may not be really the best way for them to go?
That's an excellent question. I think the approach is multifaceted. One of them is staying ahead of the expectations, and actually when I turn on the news in the morning, clicking on some of those links, so I know what my patients are seeing when they're on the internet in the morning over breakfast, and knowing what kind of questions to expect, because getting ahead of it is a big part of the game. The second part, which GBMC really allows for, is making yourself available for your patients. And a quote that I regularly will tell my patients, I will look them in the eye and I will say, there is no excuse for you to be on Google when you have a physician or an office that will respond to you the same day with your questions. And that is a commitment that I make to my patients every day, with the exception of certain weekends when try to hang out with the family a bit. But otherwise, hey, if your doctor will answer you the same day, there's no need for you to Google search. There just isn't.
Yeah, so the key is to be available and make sure that because you have the answer when they need it, it's just a matter of making sure that they know that you're available to give it.
Absolutely. Knowing that your physician is available and working for a facility that allows for the technology to really make that a smooth process. So patients calling in all the time is rather difficult. Then you're encountering long holds inevitably. There were times, peak COVID, where hundreds of calls in a day in small offices being fielded, patients backed up just wanting to know, what do I do about this cough? What do I do about this sneeze? And everybody anxious, everybody concerned, very naturally and understandably so. In our system, you can message your doctor directly. You can send a message through your portal, through your MyChart application, and it arrives at your doctor's desk and field them throughout the day in between patients. So.
Dr. Elie Miller is a family medicine physician at GBMC Health Partners Primary Care in Owings Mills, joining us live here this morning for our discussion. With primary care, you would be dealing potentially with regular issues like people coming in for their physicals and your everyday health problems. But I've seen some statistics that not very many people, or a low, unfortunately not enough people, get that yearly physical every day. How do you convince more people to come in just to get that regular care, even when they don't have a specific medical problem?
So that's an excellent question. I would divide the answer into two categories. There are your patients that come into the office that come in with 2, 4, 8, 15 different problems and only see a doctor every few years. And I encourage them to try to think of this like anything else they would in life. If you come in regularly, you're more likely to get things addressed and have encounter physicians who will have the time to appropriately address each of the issues on your list. I'll encourage patients to write down a list with me and write down those 12 things and say, well, we're going to get to 2 of them today, but you would do better by writing down this list with me and scheduling regular appointments, and we'll chip away at it. I write down the list with them in their chart in bold letters and kind of go at it one step at a time. Reminding patients that regular care and regularly scheduled preventative care can really save a world of hurt down the road. And something that I find myself telling my patients is that ignoring issues doesn't make them not there. And not getting that colon cancer screening or not getting those mammograms doesn't mean it's not going to circle around and rear its ugly head down the road. You're just staving off the inevitable.
Dr. Miller, I've heard, and I wonder if you've experienced this over the past year with COVID. There's been issues where we've heard that more people having stayed inside more often or not gone about their normal activities as they had certainly closer to the beginning of the pandemic, then stretching on months and months, not participating in what they would normally do. There's been an increase in potentially some problems with mental health, and some people having questions about that. And I know when people think of their family doctor, they might be thinking of potential for physical ailments, but can you help people, at least point people in the right direction when they're dealing with issues that arise from mental health as well?
Absolutely. I think that my attitude towards mental health and primary care, much of which comes from our department chair, Dr. Kevin Ferentz, who I was fortunate enough to study under. My approach is that the two are intertwined in almost every issue. There are very, very rare issues where I'm able to say this is purely physical and that there's no emotional component at all. Now, that doesn't always mean that the emotional component needs to be tackled right away or needs to be tackled altogether. But these things have really come to the forefront, especially during COVID, especially where everybody's stress has been pushed to the limits, and the ability to distinguish and properly demarcate professional life, home life, child raising, interviews, meetings, everything has really become blurred. And that is a stress that people are not used to. Mix that in with the unknown of COVID and the fears of COVID, then you really get a recipe for disaster. And as I mentioned in the beginning, your primary care doctor is often your first encounter or your first go-to if you have a good primary care doctor with the healthcare world. And that's often where people turn to when they are feeling stressed, when they are feeling down or anxious. And one thing often segues into another when it comes to their physical health as well. So being in a position to address both of those, which is what a well-trained family medicine physician ought to be doing, is a very important part of our job.
Is that what led you to wanting to be involved with family medicine, or what was kind of the motivation for you to be in this field of medicine?
Absolutely, and I think if some of my colleagues from subspecialties were here, they might throw something at me for this answer. But I felt like family medicine was one of the last corners of medicine where you really got to do a bit of it all and really translate whatever it was that you were passionate about. In adult medicine and pediatric medicine, you want to focus more on geriatrics or sports medicine, you can do it. It's there for you. You can do it all and then focus on some. I found for myself that I really enjoyed the broad array of age groups with a special emphasis on mental health and on weight management as well.
Now, it's nice. In the old days, there may have been a family doctor out in the small town somewhere who kind of treated all the people in that town and handled all their cares of their needs and their family. Whereas these days, you are in your office in Owings Mills, but you're with GBMC. So if something comes up, you have access to all those different specialties that you're talking about, and you actually know a lot of the people involved in the system to point them in the right direction.
Absolutely. And it's funny that you mentioned the example of the kind of the old-fashioned model of the family doctor that you picture, because I would say that some of my patients describe me as old-fashioned in a positive way, and I would wear that with a badge of pride. And I would say that in training, I saw one of our physicians here treat 3 generations of one family in the same day, treat a grandparent, their child, and their grandchild all in one day for 3 separate unrelated visits. And that is something that just doesn't exist in much of medicine anymore. Or if it does, you're talking about a scary situation. But again, in just a short time that I've been at GBMC, I've been fortunate enough to start making those links already. I have one family where, you treat the parents, you treat the children, then you treat, their grandchild, and then the in-laws. And the network spreads out, and you get an understanding of the family and the state of being of the patient that really encapsulates their day-to-day life, which is important in primary care. As you mentioned, being in a hospital environment or attached to a hospital environment allows you to always have access to those specialists, because that's a big part of it as well. When you get to the point where they need a gastroenterologist, they need an orthopedic surgeon or a spinal surgeon, it's all right here. It's right here on campus. It's right here through a variety of academic institutions that all attach themselves to the setting. So.
Dr. Miller, one of the interesting things about the pandemic going back a year, maybe this time last year, it seemed like it was still such a new virus that people really were scared and they didn't know much about it. We had all these different procedures that were being implemented. What's it been like to work in a doctor's office while trying to make sure that everybody stays safe, and now maybe potentially coming out of this pandemic? Can you talk a little bit about what that's like, along with encouraging people to get vaccinated?
Sure. It's been first and foremost humbling. And I would say that all the good physicians that I've seen shine through this, a common denominator has been an ability to say, I don't know. I'm not always going to know all the answers. There is a lot of data out there, while somehow also balancing that with a steady dose of reassurance and a steady dose of confidence that your patients can have in you. And I think that the two are possible. It's okay to say you don't know the answer to that question. It's also okay to say, I've reviewed that article that your patient brought you in this morning at 9 a.m. and said, hey, I read these 4 articles online last night. Can you tell me what to think about them? And they were just there for a strep check. but you get good at that, and I think that that's a big part of the name of the game over the past year has been balancing that confidence and making sure that the patients are able to maintain that confidence in the healthcare system. Something that I think we've been particularly good about over here. In terms of the vaccination, I truly think that vaccination is a big part of our way out of this. I think that we're very fortunate to have what I remind my patients is technology that has been around for decades. It was not invented this year. It was not invented 12 months ago by a shady corporation. This has been stuff that's been around since the 80s and 90s, et cetera. And it's all the right thing at the right time. And a lot of strokes of good fortune coming together to allow us to have vaccinations. You look at the plummeting numbers across the United States, particularly in Maryland, but really just about in any state in the United States. And you see the optimism that I certainly was telling my patients about even 6 months ago, which is that there's a finish line in sight. We got to team up to get there the same way we needed to team up 12 months ago. And we kind of came together as a community, as a nation, as a state on city level, et cetera. Continue to team up, continue to do our part. And if our part is vaccination right now, then we should be all in. I know I am.
Yeah, it seems like, I understand there are some people going in who had been skeptical about the potential for vaccines generally, and maybe even this one specifically. But it's really hard to ignore the number of people who've become vaccinated, the high percentage in the state, we're above 70%. That's happened at the same time as the number of people getting COVID and being hospitalized with COVID has come down. It's like, if someone was to believe that's a coincidence, it doesn't seem like it. It seems like the vaccine's doing part of its job.
It's almost impossible to deny its efficacy. And I think that we've been surprised as we transition from theoretical studies, so to speak, when they were initially promoting the vaccine and authorizing it on an emergency level. And we've gone into real world data now. There's usually an expectation of a transition where the numbers and expectations decline a little bit. And I say, okay, we expected 98% of efficacy, but we're going to be okay if we can get 85% efficacy. And I think what everybody has been surprised to see is that the numbers have remained strong. They've remained just about as good as they were in the trials, which is incredible news.
Dr. Miller, I want to ask you about face masks. Do you still wear them? Do you still have patients when they come to your office wear them? And I'm wondering if you feel like the fact that people were wearing them through much of the winter, along with hand washing and things like that. I wonder if you feel that did lead to a decline in other viruses and colds and flus and things like that we normally see over the winter.
Sure. I would say face masks are the number 1, 2, and 3 most loaded question that I get asked on a day-to-day basis. So you jumped right on it there. So you asked a few different things about face masks there. One, kind of what do we do now and what's expectation now? I would say that 2 patients that are asymptomatic and have both been vaccinated, there's no reason why they should wear a face mask. Certainly, it's not impossible for somebody to have COVID and be asymptomatic. Certainly not impossible to spread it. But you'd have to be crossing a lot of barriers for 2 people who are both vaccinated and asymptomatic. A lot of very low odds would have to be crossed. And that's not a fair way to live our life. I wouldn't tell my patients to live their life in any other setting with any other question to say, well, what if, and what if, and what if? That's just not a healthy way to go about it. Our anxieties transmit to our neighbors. Our anxieties transmit to our children. Our anxieties transmit to our parents, our siblings and those around us. There comes a point in this pandemic where we do need to ask ourselves, what is my threshold for taking off a face mask? What is my threshold for kind of re-emerging, so to speak? So I give my patients a choice if they're vaccinated, if they'd like to wear a mask while they meet with me. But if their answer is that they would like to keep the mask on, I only ask them that they go home and consider an answer to that question. What is their threshold? Another thing that you asked there was, did this lead to suppression in common cold? And the answer is absolutely. Seeing a dramatic spike, particularly in New York, but certainly in areas of Maryland as well, in common cold, RSV, which is a pediatric respiratory illness, often diagnosed in infants, can be confused with asthma. And seeing a spike that generally occurs in December, January, February. I think what a lot of the epidemiologists that I speak to and the people exclusively practicing pediatrics, my pediatrician colleagues, what they're looking at very closely is, are these numbers reflective of the same numbers that we would have seen, the literal same numbers? If we would have had 100 cases in December, are we just having 100 cases in May? Or are we seeing some sort of rebound spike, so to speak, with all the kids having been separated during those peak months of the pandemic?
And now coming back together. That's interesting.
Mm-hmm.
If we are seeing something like that. Dr. Miller, just last, if you could talk a little about what you expect now. It certainly appears that the numbers are going down with the pandemic, and we're coming back to something resembling what we used to consider a normal life. So what's it going to be like for you going back to being a family medicine physician at GBMC?
Cautious optimism in every aspect, and remembering the good things. And I do mean that. And I say that as somebody who witnessed a lot of suffering and saw people very close to me get very ill from COVID, and one of them pass away. With that being said, there was tremendous upside on a personal level for many families. Many of my patients have spent the last year seeing more of their children than they ever saw, spending more time with spouses, partners, family members, realizing that parents living miles away or states away is maybe something that we shouldn't compromise on, something that we shouldn't just consider the day-to-day life. Maybe we should be spending more time outdoors. Maybe we should be spending more time hiking. Recently spoke to a friend of mine who said the past 2 months have been the busiest months of work in his life as he got back to things. And he realized he had stopped doing what he did the whole COVID, which was go hiking twice a week with his kids. So he said this week he just turned everything off Friday at lunchtime and took his kids hiking, and everything was okay. So remember the positive and be optimistic. And this was a painful year, and it's going to take all of us a lot to dig out of it, and just continue to be supportive of one another.
And get your yearly physical.
Oh, yeah.
That's the recommendation. Dr. Elie Miller from GBMC Health Partners Primary Care in Owings Mills. Thank you so much for joining us this morning. Best luck to you going forward.
Thank you so much for having me.
And thanks to you for watching this special Facebook Live presentation with our friends at GBMC. I'm Christian Schaffer. That's it for now.